Foluso Fakorede. I am a cardiologist who is based out in Cleveland, Mississippi, but I tell people I represent the whole Mississippi Delta. So I'm not here just for one clinic, I'm not here representing one hospital, I'm here representing the unheard people here in the Mississippi Delta. I started my practice in 2015. It's called Cardiovascular Solutions of Central Mississippi. And the core value of our practice are the following. One, every patient is treated as a family member. Two, we need to be a voice for the voiceless when it comes to raising awareness pertaining to issues concerning, one, cardiovascular disease, two, reducing unnecessary amputation rates here in the Delta, three, reducing the stroke rates here in the Delta, four, reducing the heart attack rates in the Delta, and five, emphasis on prevention over cure. That last piece is interesting because my training is an interventional cardiologist, meaning that I am the kind of doctor that you call when you've been diagnosed with a heart attack or you have poor circulation, and my job is to intervene. So you've already had the problem and I need to fix it. But after working here for a year, I realized that part of my journey and part of the goal is to try and prevent people from getting to that stage. Prevention is important here in the Delta because we have the highest rates of every chronic disease that is known to date here in the country that has disproportionately affected the state of Mississippi. Namely, diabetes. We ranked number 1 or number 2 since 1990 to 2016. 2, deaths from cardiovascular disease. And I'm going to explain what cardiovascular diseases are. But say as a country, we've seen an improvement and a reduction in deaths from cardiovascular diseases over the last 20 years. However, there are certain states and certain populations that have not shared in that glory. And those are people who either live in Highway 61 or the crossroads. We have not seen that reduction. So as much as they're celebrating this new news of decreasing mortality rates and decreasing death rates in Connecticut, in New Jersey, in Colorado, we do not see that benefit here in Mississippi. So our death rates from heart and vascular disease have actually gone up. The life expectancy for a male in Tunica, Mississippi is 68 years old. 68. That is 10 years below the national average. Now, also, that parallels a third world country's life expectancy. So how come we spend so much money on healthcare in America, and we have all these technological advances that y'all see in TV, we see about all these new medicines every week that's publicized, but we're not bearing the fruits of those technological advances or such healthcare advancements? There are a couple of reasons for that. One, we have the lowest number of physicians per capita in the country here in Mississippi. We also happen to be the poorest state in the country. And we also happen to have a region that is actually majority African American, highest percentage of African Americans than any other state except for Washington, D.C., right? And that's not a state, that's the capital. But the point is, how come we are disproportionately affected? We have the lowest number of doctors and the highest prevalence of every chronic condition, and no one is doing anything about that. I mean, it's a question that bothered me for about a year. So the key is to go out to the community and bypass, depending on doctors to be the solution, and look at the strengths of every community. And so I thank y'all for, number one, organizing this event, Jackie and her team, and the Soro, especially the Kappa Alpha Omega chapter, for organizing this event, because what y'all are doing today is you're becoming informed to be transformed, and you're saving lives. 1 in 3 women in this room would die from cardiovascular disease. 1 in 3. That is, every 37 seconds, someone will die from cardiovascular disease, and every minute a woman would die from cardiovascular disease. That is worse than all cancers combined. When we mention cancer, every woman in this room will get more scared than if I mention peripheral arterial disease or atrial fibrillation or arrhythmia or coronary artery disease, right? Cancer scares everyone. I'm just telling y'all that cardiovascular disease is actually worse. than cancer. So let's define it. What is it? Cardiovascular disease. Now raise your hand if you know anyone who's ever had a stent in their heart or anything known as plaque buildup in their heart where they've been told they've had a heart attack. Raise your hand. That's known as coronary disease. Keep your hands up. Raise your hand if you know anyone who's had congestive heart failure or fluid around their heart. If you had anyone who's had valvular heart disease, they've said leaky valve, murmur, raise your hand. Anyone who's had an irregular rhythm, atrial fibrillation, ventricular tachycardia, SVT, supraventricular tachycardia, or they've been told that you hear beats around your ears. Anyone who's had a clot in their lungs, pulmonary embolism. Anyone who knows anyone who has varicose veins. Anyone who knows anyone who has poor circulation in their legs. And amputation. All right, so everyone is raising their hands. The culmination of everything I said is what constitutes cardiovascular disease. It's not just a heart attack. So let's understand that. So the difference is that when you're born, we're born with clean pipes in our arteries, right? These are pipes that go to blood circulation in your brain, in your heart, in your legs, in your stomach. As we get older and we start eating, Cheetos, and our parents are giving us all that soda when we're young and everything, that, sweet tea, we start building up this yellow substance called cholesterol, okay? So these are deposits that line up the vessels of the walls, and they start developing. The more sugar we build up, the more salt we eat, the more fast foods we eat, then they clog up your arteries. And when they clog up your arteries, you have a decreased blood flow going to all those organs, not enough oxygen-rich blood going to your organs. And when that happens, you develop the following. If you have decreased blood flow to your brain, what do you have? Stroke, right? Highway 61 is the stroke belt of America. If you have that developed to your heart, you have heart attack. Highway 61 are the crossroads, or the heart attack belts of the country. If it's going to your kidneys, you have what? Kidney disease, or at its end stage, you have dialysis, right? Every town in the Delta has like a big dialysis center. That's alarming. But if it's poor circulation going to your legs, and this is happening to your legs, you have what we call peripheral arterial disease, or at its end stage, you have gangrene of your foot, non-healing wound and ulcer. And when you go see a doctor, rather than them unclogging this, they will chop off the toe, right? Or chop off the leg and tell you that's treated the problem. Now, has that treated the problem? No. Okay. If every woman in this room had a breast mass and you went to see a doctor and they walk into the room and just without doing anything told you that they were going to just take off that breast immediately, without a biopsy, without anything, how would you feel? Yes. So that in itself is an analogy that I use when people have poor circulation in their legs. That is the analogy when you see someone who's had a heart attack, watching that in front of you, and as Jackie actually pointed out, CPR is very important. When someone collapses in front of us, there's some patients that I've seen where the family just watches for like 20 minutes, for 10 minutes, without doing anything. CPR is the most vital and the easiest tool to learn and teach our kids. Every single kid, I don't care how old they are, even the baby should learn CPR because it saves lives, all right? So I hope that by the end of my talk today, that you guys will, you ladies will get a lot of the tools that you need to not only question some of the medical decision-making that pertains not only to your health, but your families, but that you become engaged and become advocates for the next lady next to you, your mother, your sister, your brother, with all the information you've gathered. So let's talk about the risk factors that are preventable. I'm going to start with the risk factors. One, the number one most preventable cause of death in the country, or actually in the world, is what? Does anyone know? Number one preventable cause of death is what? She said exercising. That's close. It's called your dietary risk. What you eat. What you eat is the number one preventable cause of death. Before that, it was nicotine. It was smoking. But that has now flipped to number two. But number one is your dietary risk. So what we eat, why is that important? What we eat is what has caused this progression of plaque buildup known as atherosclerosis. If you eat a lot of sugar and you become a diabetic or pre-diabetic, your rate of plaque buildup is 3 to 4 times faster than someone who's not a diabetic. So that's why you see young patients on dialysis, young patients getting amputated, and 30-year-old ladies who are having heart surgery in their 30s. Because of that. So it's what we eat. So does everything fall on us as individuals? Yes, there is some component to individual responsibility. But there's also systemic issues that actually bother me when it comes to this topic. Because the fact that there's a disproportionate number of fast food restaurants compared to healthy choices in our communities, especially in the communities where predominantly minority communities, bothers me. And so the policies that are in play to allow that to happen need to be addressed. But before we get any policy changes, we can't wait for our politicians to make changes for us. We just need to make personal choices. Do things in moderation and eat right, right? And so at some point, I'm gonna have my office manager, who's also my nurse and is our nutritional guru, come up and we'll have these discussions because we have this informative discussion as to what the right food choices are. So Amy will come up at some point. But that's number one, your dietary risks. The second is, and everything you will realize are interconnected. Number two is high blood pressure. High blood pressure. Now, y'all are gonna go there and get checked at some point, and they're gonna tell you a blood pressure reading. And with no offense to anyone who's checking your blood pressure today, the one single number that you get today is not the final number of your blood pressure. In my practice, I tell everyone this: when you come to see me at my practice, or any doctor, that's actually the worst place to go get your blood pressure checked. You don't understand that, right? Because number one, you're trying to figure out what his name is, how to pronounce it, what he looks like. 2, how much is that copay again? 3, why am I waiting for 30 minutes to wait for you? I gotta take care of the kids. We got errands to run. 4, all right, how many meds are y'all potentially gonna put me on? So by the time you get there and my techs come in and check your blood pressure, it's high. So I tell people, like, calm down. We give them a book. We say, go home and register your blood pressures for a good 4 to 5 days. Give me ambulatory blood pressure readings. So at least 3 readings a day. Space them out, morning, afternoon, evening, and then document it at least for 4 to 5 days, and then bring that to the office that this is my ambulatory blood pressure readings. Those have been shown to be actually more predictive and more informative than any other reading anytime, all right? So that's one. And you want to make sure that the blood pressure cuff you're using is a modern one that has been calibrated. So bring that to the doctor's office and ask them to calibrate it for you, okay? Very important. So that's high blood pressure. If you drop your high blood pressure by about 10 points, all right? So a normal blood pressure is what? We've had this debate going back and forth. But you're going to test him on this? Okay. So what's a normal blood pressure reading? Anyone? I know there's some medical professionals in there.
120 over 80.
120 over 80? Yeah, 120 over 80. Is that the final answer?
No.
Is that the final answer? So before we used to say 120 over 80, but then there was this modification to the guidelines that said, we should look at numbers less than 130 over 80 is what people are trending towards now. And that's been the debate. 120 over 80, less than 130 over 80. It all depends on the patient population you're treating and what comorbidities they have. But as a general rule, people say less than 130 over 80. Okay? That's 1. 2. When you have certain conditions, your blood pressure is going to be elevated. So if you decrease your blood pressure by 10 points, you decreases your chances of cardiovascular risk and death by 30 to 50%. 30 to 50%. That's a big number. So decreasing your blood pressure is good, but then how are we going to decrease that blood pressure? Is it by medicines alone? No. What if someone calls the hogs all night and snores all night?
right? They have what? Sleep apnea. Well, when you have sleep apnea, you don't have enough oxygen that's going to all your organs, and there's not good sufficient exchange, and then that stresses all your organs, and your blood pressure goes high. So then you go see a doctor, and the doctor says you have high blood pressure. Here's medicine. They give you one pill. You come back 2 weeks later, it's not working. We add a second pill, right? You come back 2 months later, it's still high. We add a third pill. Remember, this is cost to your wallet. The fourth pill is added later on. And no one has yet done a sleep study to check if you have sleep apnea. So you have to know the signs of sleep apnea, and you have to know if you get tired a lot, despite getting 6 hours of sleep. If you feel like you haven't had any rest of sleep, you're somnolent and you're narcoleptic, like falling asleep on everyone all the time, all right? Especially during the daytime, and when you snore excessively, and what they call the hogs, as they say. Those are things that you have to get checked for sleep apnea. Get a sleep study, because if you get a sleep study and they put a CPAP on you, you will decrease your blood pressure by at least those 10 points. 1, 2, you will come off of 2 blood pressure medicines. And 3, now you have enough oxygen going to your lungs so that you can exercise and lose whatever weight you want to lose, so that when you walk into a room next time and the doctor just looks at you and says, go lose weight, you'll be informed to know that I can't lose weight if I have a condition that I need to treat. See where I'm going with that? So you have to understand that there are a lot of things in play other than just that number. 3, we have to know what our body mass index is, our BMI, because obesity is a big problem, not only from an adult standpoint, but to kids. We're seeing now childhood obesity being an issue. So we have to understand that, you have to be sensitive about this topic, especially when discussing it with women. I'm very sensitive because I'm smart, right? We'll be talking about people's weights just like it's not that easy, right? So I say we set realistic goals. So if you're my patient, I say, okay, what are some of the issues? And you have to address some of the mental issues, because it's not just like some it's mental. It's like, all right, you have to get into that discipline of knowing how to exercise, right? You have to know that you have to create time for yourselves, ladies, because you always say, I don't have time. How many of you claim you don't have time? I call a lot of bull on that, okay? You know why? Because the average person apparently has about 90 minutes of free time in a day. 90 minutes. 1. 2, y'all would take care of hubby or your significant other. You'll take care of the kids. You'll take care of the dog. You'll take care of the cat. You'll take care of the car. You'll take care of your boss. You take care of everything that is alive and the church before you take care of you. And so 1 in 3 women die of cardiovascular disease because, 1, they're ignored. 2, you all ignore yourselves. Let's keep it 100, as they say, right? Right? With the young kids in here. Yeah, let's keep it 100. Yeah. Because you ignore yourselves. You will take care of every single thing before you address you. So there comes a point where you just got to address you. Like everything just, you know what? If these kids want to see you for a long time, I need to take care of me. So whatever time that I need to exercise, within that 90-minute frame, I will make it happen. And you put that in your calendar of things to do. So it's mental because it's discipline. Just as we're disciplined to wake up every morning to brush your teeth, that is the same mental discipline that I use to say, okay, I'm going to exercise. Even if I skip a day, I'll make it up another time. Because if you get into that discipline, it works. And if you lose 3 pounds a month, 3 pounds a month, I'm not saying a week. Because people are going to come to all these diets now, and I'm going to address that next. All these diets out there, right? 3 pounds a month is a perfect start for me. Because if you lose just 5 to 10% of your weight, you will gain a significant amount, including 30% of that risk of death is gone. So that's number 1. Number 2, what diet do you get on? As a cardiologist and interventional cardiologist, we're governed by a body, just as your, pink or red for heart health is governed by your chapter, right? The chapter had the president. Where's the president? Boss lady has to sign off on the dates and everything. We are governed by a body, and the only diet that I can stand up here today to tell you that works is the Mediterranean diet and plant-based diet. So y'all need to look up the Mediterranean diet. All right, that's the only diet I can sit up because that's what we have in our guidelines as of today. That might change in 2 years from now when they rewrite the guidelines. So all these other diets that y'all have heard of that work acutely, I'm not gonna mention their name, keto. You know, they can work acutely, that's cute, you know, that's good. It works for some, but you know, there's a component to that diet that doesn't work for me from a biochemical and physiological standpoint because some of the components that they're telling you to skip, your body needs actually from a cellular standpoint to survive. So that's a whole nother chapter. And I'll leave it to the expert nutritionist to battle it out. So that's important. The third thing that we have to talk about is, you know, physical inactivity. So that's a transition from this weight thing to physical inactivity. So why is physical inactivity a problem? There's one of the big issues when people say, well, why is Mississippi, you know, embedded with a lot of chronic diseases? They've ranked states that are highest activity, from physical activity to lowest activity, so physical inactivity. And the number one state with physical inactivity, unfortunately, is the Mississippi Delta. Okay, that's the number one state. Now, I don't know if you know this, but heart attacks are reduced by 50% just by walking 30 minutes a day. 80% of heart attacks are reduced by vigorous activity 1 to 2 times a week. All right, 90% reduction of heart attacks by vigorous activity 3 to 4 times a week. And if you do it 5 to 6 times a week, you reduce your rates of heart attack by 98%. But the question is, what constitutes vigorous activity? What is that, right? Is it walking around the halls of Walmart and just saying, you know, I've done it 2 laps, we're good, let's go? No. Race walking, apparently. Race walking is 1, jogging is 2, running is 3, okay? 4, swimming laps. If you like to swim laps. That works. Aerobic dancing. 4, any bicycling that's 10 miles per hour or faster, considered vigorous activity. Jump rope, right? Jump rope is. Any hiking uphill is vigorous activity. And then anyone who likes to do heavy gardening, if you like to garden, like, you know, you guys have gardens, and you do heavy gardening, that's vigorous activity. And the last one is anyone who plays tennis, singles, not doubles, okay? That is vigorous activity. If you can do any of those, at least for 150 minutes a week, you are good to go, all right? There's some people who are limited by arthritis or the gout and what have you, and those things are, you know, have to be addressed at some point as to what the cause of those elements are, so that we can now put you in a program with the help of a physical therapist or, you know, exercise person, physiologist, who can help you get to your desired goal, all right? So physical inactivity is a big component of that. Another component of that is our high cholesterol and tobacco use or tobacco exposure. So when I first moved here, I used to ask all my patients, do you smoke? Do you smoke? Do you smoke? And most people would tell me no. But I you know, about a year and a half in, I smartened up. I'm like, okay, I need to understand the folks because most people here actually don't smoke, right? What do they do? No, what I know. I was born in Africa. I came to the States when I was 13. I grew up in New Jersey, New York. A lot of people up there don't chew, but that's something, but nicotine is nicotine. So understanding the community that you treat is very important because that took me a year and a half to figure out. You know why that's important? When they do all these research studies, all these medicines that y'all see on TV, that none of y'all were included, by the way, in, because African Americans are not included in research. Women are not included in research trials. Women are not included. Out of all the major heart attack trials and cardiovascular trials, only less than 30% have included women to date. Out of all the trials. Just FYI. So when you see all these trials, they always ask people, do they smoke? What is the tobacco smoking rate? So I'm like, wait, most of these people care, don't smoke. They chew, they dip, they vape. Like some people vape. Nicotine is nicotine. Your life expectancy is reduced by 8 years by having nicotine in your system. 8 years. All right? 1. 2. By the time you quit smoking, it takes you 15 years to get back to the level of someone who has never smoked before. So that you guys become on the same playing field. So just because you quit yesterday doesn't mean that your plaque buildup rate has stopped. Once you quit, you still have another 15 years to go. So you gotta take yourself seriously. So that's why your nicotine exposure rate is something that you have to understand. If you see any family member who smokes or who dips and chews, I always challenge them to grab the most important person to you, look at them, and tell them that you rather continue dipping, chewing, smoking, or vaping than spending additional 8 years here on this planet with them. If you cannot do that, if you're not man enough or woman enough to do that, then you gotta quit. Because that's 8 years of life that you can gain and you can be productive not only to your family but to society. The last topic I'm gonna talk about are what are some of the social determinants of health in terms of our transportation and access to care, quality care. There's access to care and access to quality care. Let me give you an example. You have a family member who's been a diabetic for a long time. They've been rubbing alcohol on their feet because they've had some burning neuropathy on their feet, right? 2, they come and they say, you know, my toe is dark. It's been dark for about a month. And then they stepped on like a nail and it went into a wound. And they went to see a doctor. And that doctor says, you know what, I'm gonna recommend that we try some wound care treatment first. And then if it doesn't work, we're gonna chop off that foot. Okay? So you went to see a doctor. They sent you to wound care at a hospital. And then they chopped off the toe. And then 2 months later, it's not healing. And then they chop off what? Another toe. And then it's not healing and they chop off another ankle. And it's not healing and they chop off below the knee. Is that story familiar? Yeah. Okay. So but you had access to care, right? There was access to a medical care. All right, so that's on this side. On this side, you had the same story. You go see a doctor and they say, you know what? Let's do an ultrasound of your legs, or let's make sure your sugars are controlled. Let's address why your sugars are controlled. If your primary care doctor is not controlling your sugar, I'm gonna send you to a sugar specialist known as an endocrinologist. We're gonna get your hemoglobin A1C down. Your blood pressure has to be correct. We have to make sure that you have transportation to make it to all your appointments. You gotta make sure that you have good circulation going down to that foot, because if I send you to wound care, all that antibiotics they're gonna give you needs oxygen-rich blood to get to it. So we gotta open up all the clogged pipes to make sure that it's going there, right? And then we're gonna do a procedure that's not surgery, that's gonna unclog those pipes. And we're gonna try and heal this toe. Give it some time to heal. We're not gonna chop off anything. We're gonna be very aggressive. And if I cannot do it, I'm gonna send you to someone else who I think might be even be better to do it. So second opinion. And that person's toe is safe. So do you know what the difference between those two things are? It's not just access to care versus access to quality care. The person who got amputated will be 80% will be dead within 5 years. 80% of amputees are dead within 5 years. That person who's been saved gets their toe back, can go back and work in the community, can take care of their families. This person who lost their toe, their legs, needs all the family members to now sacrifice time away from work, time away from education, to come and take care of them. All right? And then the cost to the family, the healthcare cost to take care of an amputee is about $500,000 in the lifetime of that patient. So that averages to about $120,000 a year. By the time we get a rail for that person to walk, a new car, right? They got to get prosthesis. In Mississippi, majority of patients actually cannot afford a prosthesis. So these are the things that some doctors just don't think about. So that is access to quality care versus access to care. And that is why addressing your risk factors are very important now, because prevention is better than being presented with that opportunity for someone to screw things up. Because it not depends on the name of the hospital. It doesn't depend on, the Ivy League training of the doctor. Actually, it doesn't depend on the city, because everyone thinks like, yeah, if I go to Jackson or Oxford or Memphis, I'm gonna get top-notch care. In some things, there's more opportunity for more doctors to be available there. But all I'm just saying is every physician and their approach are different. But you have to be informed to be transformed, and you have to be informed so that your life and those of your family members are not left in jeopardy for a physician to dictate their outcomes. So that's why this is important. So I highly advise that we do a better job of addressing things like sugar. Sugar is the new tobacco. We have to address it aggressively. Make sure that we minimize that. Make sure we minimize our fat content in our diet. We minimize our exposure to fast foods if we can. Salt intake, we have to minimize that. And then we have to get preventative measures in place. Any woman over the age of 21, make sure you've had your thyroid checked. The thyroid gland has to be checked. Why? Because it affects your cholesterol, it affects, your blood pressure, actually. And then some people can have swelling in their feet that's due to thyroid disease that they don't know about. Okay? So get your TSH, your thyroid gland checked if you're over the age of 21. Your cholesterol, you have to know your cholesterol numbers at all times. Okay? That HDL, the high number, we want that higher. LDL, we want it lower. All right? If you know anyone in this room who calls the hogs or who snores, go tell them to go get a sleep study. All right? Go get your blood pressure checked for readings. Make sure we do that. We have to exercise. Physical activity should be our new norm, not inactivity. All right? And then we also have to make sure that we stop smoking, dipping, chewing, and vaping. Make sure that's taken off the table. Because ultimately, those are the things that can save lives. In addition to CPR, we have to learn CPR, right? So these are the things and nuggets I wanted to give you all this morning, just to kind of digest. I'm going to have Amy Harlow come up. She's the nurse clinical manager for the practice and has done a lot of these events with me where we talk about the nutritional aspects. That's her thing. Amy is we have both a vascular component to our lab and a cardiology component to our lab, so we deal with the whole comprehensive picture. And so we'll start with just kind of your spiel as to what it takes. Be careful with the sweet tea comment, by the way, because y'all take it easy on Amy. But she keeps it real. She keeps it real. She's Colorado, right? You're from Colorado?
Colorado.
They're the healthiest state in America in Colorado, so they don't see some of the things we see in the Delta. But one thing that I tell you is that every patient in our practice is taken care of as a family member, and what she's talking about from experiences by living here for all these years and seeing what basically the health injustice that's happening in the Delta. It's a health injustice. As Martin Luther King said, of all forms of inequality, injustice in healthcare is the most shocking and inhumane. There shouldn't be a reason why we, as a community here in the Delta, should be disproportionately affected with all these chronic diseases and not have kind of a stepping stone and recruitment of more doctors and specialists to come to this region and incentivizing them to do so, and helping our educational system to be better, and helping our nutritional system to be better. Those are the things that have to work hand in hand. So Amy will take it, and then I'll kind of chime in as we go. All right? Cool.
Good morning, everybody. I am from Colorado, and if you look at these statistical charts, Colorado is the healthiest and continues to be the healthiest state. As we talk about social determinants of health and the issues that plague in this area, it is very overwhelming, and you don't know where to start to fix that problem. But the one thing we do have control in is what we put in our mouth every day. And that is a really hard thing, and I used to think, oh, that's just simple. But when you grow up here and the foods that you have, you equate that with mom. That is your comfort level. Where I grew up in Colorado and I had a PE teacher for a mother, that's my comfort level. So try to fit that bridge between what you know, what you love, what the people around you are doing. But nutrition, I cannot stress enough that is what is going to save us and make a difference in us. If you don't have good nutrition, you're not going to exercise. You're not going to feel like going out. And we are plagued with fast food restaurants. That is a problem, but it's also a problem because we put our dollars at those fast food restaurants. Just recently, I was at Walmart, and there's a bread that I love, and it's gone. And it's a bread that is healthy and it's good for us. But Walmart's gonna stock the shelves by what is selling. And we are tricked, duped by the nutrition industry, and that is across the country. Every magazine has diets in it and lose weight, and we all care about it, but we're so confused and lost about what to do. Dr. Fakorede mentioned the Mediterranean diet. That is the gold standard. That is the diet that is the healthiest across the board, is the diet that has been researched by the cancer industry, the cardiovascular industry, and what it is that it's plant-based, almost to the vegetarian level. If it does not come from the ground or come from a mom in a direct route, don't eat it. God made us in this pure form, and then he gave us plants. When we start adding chemicals to these plants, we start frying it, it changes the quality of this food. And as you read the Mediterranean diet, you're gonna see oils. One of them is olive oil. You get rid of the butter. You get rid of the margarines, because that is a healthy oil. But it's also in moderation. Don't go deep frying in olive oil. Don't start pouring it on everything. You have to have that moderation. Because it still matters what you go in, and the volume that you go in on it is going to be fat. You take a chicken breast and you start coating it in bread, flour, eggs, you thicken it, throw it in oil, you have ruined the effects of that chicken breast and that healthy thing. I hear a lot of people saying, I can't afford healthy food. Yes, you can. A pound of broccoli costs about $1.80. A pound of peas costs 78 cents. A pound of chicken breast costs $4. A pound of steak, Lord knows how much that costs. $12, $14 depending on where you go. So how can you not afford it? It is healthier and it's whole. We all can have gardens. We can all do that. We can get the frozen vegetables that are 89 cents in a bag and learn how to cook them. We don't throw them in with the bacon grease. If you got a bacon grease can in your home, I didn't know that would happen until I came to the South. Throw that away. You might as well be eating fast food. You are clogging those arteries. You are affecting your liver because it cannot metabolize that fat. I don't know where that became a good idea. Throw it away. The other thing, like, this isn't a diet. It is a lifestyle. It is something that you have to put part of your life for the rest of your life, and teaching your children from the get-go. If it's on Pinterest, if it's on Facebook, don't believe it. Coconut oil. Everybody has swish, swash, swallow it, I want to eat it. You might as well eat motor oil for your body. It is a saturated fat. It is going to clog your arteries. It's taken a while for the medical community to come up with some research for it, because research trials are expensive, they're time consuming. It's just not easy to start up a research. In the beginning, it was such a joke that a lot of people in the cardiology world thought, nobody's really going to do this. Well, now everybody's swish-washing and swallowing this. You are loading your body up with saturated, solid fat. If the fat you're looking at is solid in any form, especially when it's at room temperature, you're good for your body. Crisco, lard, coconut oil, all of those are like the worst things possible. So children, we probably can tolerate 2,000 milligrams a day. That is 1 teaspoon. If you have high blood pressure, kidney disease, diabetes, anything else, and just the thing of age, when we start getting into your 50s and 60s, we gotta eat better. That should go down to 1.5 teaspoons of salt in a day. That's 1,500 milligrams. One McDonald's cheeseburger is 700 milligrams. One chicken platter from KFC or Popeyes or whatever, you're talking about 1,000 milligrams of sodium in one meal. So
Go to Popeyes.
one healthy thing, throw the salt shaker away. Get rid of it at your house. Or you cook with it very slightly, but it should not be sitting on your kitchen table. Nobody should have access to the salt on a regular basis.
It's hard to control the salt intake if you eat out a lot.
Yeah, if
So
you
that's the
eat
key.
out,
If you eat out a lot,
you are over the top.
You have given control to whoever that cook is or that entity is. So the point is that if you cook it yourself, at least you can control the quantity of salt that you put.
And if you eat out, do not add any extra salt to it. Learn to love pepper, lemon, seasonings, the herb aisle, explore that for your seasoning and your flavor. When you're used to a really high salt diet, it's gonna take time to readjust your taste buds. Your taste is it's gonna taste bland, but I promise you, if you give it 30 days, all of a sudden, it's gonna get better. And you're gonna taste what food really tastes like instead of tasting the salt that you're adding to it.
What about carbs? White, brown?
Long ago, you noticed that I'm blonde, blue eyes, and I started joking with people that the only thing good in your life that is white is me. Meaning that if it's white flour, white sugar, get rid of it. Do not add it, and it is a treat. In the Mediterranean diet, a dessert consists of fruit. Or they have, Mediterranean, what that means is a region of our world. And it's bordered by the Mediterranean Sea. The countries include North Africa, all the countries that are in there, Italy, Greece, and some Damascus in the Arab world, and it's right around that. But what they started to find is that the people that were eating this diet, the areas in this country where they were eating the traditional diet, they lived longer and they didn't have the cardiovascular disease. Sugar is very limited there, and so they didn't have it. They didn't eat it. They had fruits. They had vegetables. They don't have the resources for the land to have cattle fields, and they fished a lot. So those were the things that started incorporating it, and that's why we went to the Mediterranean, that region.
So what
Sugar,
about pasta?
pasta in moderation is good.
Brown, white,
Brown. If you have a choice,
rice.
you go brown. White rice, you might as well eat a cupcake. It has no nutritional value whatsoever. And just because it's brown at the Chinese restaurant, that's not brown rice. Because I've had patients go, I'm eating that. You just loaded it up with sodium. So you're eating a cupcake with salt on it, in essence, is what your body does to it. Brown rice, molasses, agave, honey, anything that is in that source, it's sweet, it's sugar. And it needs to be cut to an absolute moderation. You gotta think in the 1950s, sugar was hard. You had to have rations for it. During the war, it was expensive. We limited. And if you're doing a lot of physical activity and you're working out in the fields and you're walking to school and you're walking to all of this, your body can tolerate a little of that. But we don't have that lifestyle anymore. And so it's gotta go. Sugar fuels cancer cells. It is what clogging the arteries, and our diabetes, it is epidemic. We are burning our pancreas, and it's starting at this young kid's age.
1 in 3 adults will be a diabetic by the year 2050. So, pre-diabetes, we have 80 million patients who are pre-diabetic, and another 30 million that are diabetic. And we're seeing higher rates of pre-diabetics becoming diabetics. And we treat, in our practice, we treat both the same. There's nothing like, I'm a little pregnant or pregnant. It's either you're pregnant or you're not. Right? So that's pre-diabetes, diabetes to me. We treat you aggressively. So in terms of the diet piece, it's making sure that you understand that sugar is the new tobacco. Sugar is the new tobacco. That's our big problem now. So we have to really address what the juices, and she'll talk about that, is, what do we consider to be safe or not safe?
Pre-diabetes to me is the worst diagnosis. You are still diabetic, but we think, we gotta pass. I'm not, and I guess it's a lower form of diabetes, but you got a warning. The damage that pre-diabetes doing to you is just the same. And if you don't take control, and then our doctors don't give glucometers, they don't give you any way to manage this pre-diabetic level. And I see too many patients say, well, I'm not diabetic, I'm pre. So you hear that pre in your world, get rid of that pre. You are a diabetic.
Yeah, and the subtle symptoms you have with the pre-diabetic is what we call microvascular. So this vessel, this sample I'm using, these are large vessels, we call them macro vessels. The micro are the little small vessels that are your eye, so vision changes, your nerves, neuropathy, right? Numbness, tingling in your feet. And then your kidneys, sometimes you leak proteins in your urine. You can't see it until they check the urine sample. So vision, numbness, tingling, your urine has to be checked. Those are things that you have to follow with your primary care doctor, and too, they have to address some of the things early on that are contributing to that. And if you feel that your numbers are not getting right, like your hemoglobin A1C is the number that we all talk about. That's the difference between a pre-diabetic and a diabetic. That's just a protein that's coated with sugar that is checked every 3 months, and that tells us if you are going to be in the range of a pre-diabetic or a diabetic. What I tell people is that if that number, by every 0.1 increase, if you went from a 6.3 to a 6.4, your chances of having a heart event has gone up by 15%. Your chances of having poor circulation has gone up by 28%. So just that 0.1 increase has increased your risk. So think about it, a 0.1 decrease will have opposite effect. So we have to be aggressive in terms of treatment and in terms of recognizing that if your primary care doctors are not treating you right, go see the endocrinologist, like a specialist, someone who's trained. There's only one problem with that. Mississippi has only a few number of endocrinologists. In spite of having one of the highest numbers of diabetic patients, we only have about 6 or 7, which is sad. So that has to be addressed. Yes, ma'am, you had a question?
So what y'all saying, if you're taking medications for this and all this, you can just start to eat like what you say, and you can throw away all the medicine. Just throw it out the door. It's over with.
You might be able to decrease.
You decrease
If
it, don't throw
You are
away.
at the point where you have high blood pressure, you have coronary artery disease. We can maybe slow the progression, halt it at where you're at. Maybe with extreme diets, and there are some. One is the Ornish, which is a degree of the Mediterranean diet. He has shown reversal. But you have to have that for your lifetime. Don't think you're going to eat broccoli for 2 weeks, and you're going to be cured, and you come off all your medicines, and we're not going to claim it anymore. It doesn't work that way. Now, for this sweet child that's sitting here, you can change her life. You can change the effects
Yeah,
of
so
her life.
what she's talking about, what you just mentioned, this rate of plaque buildup that I showed y'all is something that's affected by age as well. So as we get older, we build up plaque. You cannot reverse that. That's from the man above. You get older, we can't reverse that. Your sex is something you can't reverse, men versus women. And then, your color of your skin and your family history. Those are non-reversible risk factors. If you're a minority, you can't reverse that. Your chances of having poor circulation or a heart event are actually a little bit higher than someone who looks like Amy. That's just a fact. And then the fact that we have a family history that's stronger, you can't change what family you were born into. So if you take away those risks, and you talk about the reversible risks that we're talking about today, in terms of your dietary changes, if you're a smoker, you address it. If you have high blood pressure, you treat it. If you're physically in activity, you you exercise, you can actually change that trajectory 90% of the time. So 80 to 90% of the condition that required you to be on medications in the first place could be treated aggressively, and you can come off of some of those medications. I can't promise you that you're going to be 100% off medicines because of those other risk factors that are non-reversible. So that's kind of what we're highlighting here. Know your reversible risk and your non-reversible risk, and do your part in changing your trajectory of what you can reverse.
When
Back
they
to
go
the-
weight, I always hear them say your weight goes by your height. Is that true?
The BMI, so, yes ma'am, so, yeah, the body mass index is a ratio of, your weight, your, weight and height. You take, that difference and that ratio. What's wrong with that, as I've stated on multiple platforms now, and I'm not shy to say this, is that if you were to take someone from Colorado, and you were to take any woman from either Nigeria, where I was born, Africa, or any woman from here in the Delta, their ratios of their hips are different, right? But your BMI is calculated based on someone who looks like this. So that's what they want the whole world to look like. It doesn't work that way. So that's another, that the physician who's treating you has to know all this too, because you can't say, well, I want your BMI to be 18 to 25. For some, it's not fair. So it's that, where do we have that fair playing field where you can say, okay, let's work with you. I don't want to compare you to Colorado now. I want to compare you to what I think I can change and things that I know you can affect and change. And that weight loss, this is our goal, and we're going to come up with a plan. Let's focus on that rather than you comparing to someone who doesn't look like you from a bony structure. Like, it doesn't work that way. So that is a problem with whoever came up with that map, okay? And unfortunately, I can't change that. I can't come up with a whole new map.
So one more question.
Yes, ma'am. Oh, that's a lot of questions. We're here.
Like big stomachs and big bellies,
Big
is
sto-
that mostly grease and?
Yes, we're not gonna front on that,
That's
yes.
a cheeseburger.
I didn't know just about,
It's a cheeseburger. It is, yeah.
Metabolic syndrome is I don't know if y'all heard of metabolic syndrome. Metabolic syndrome is your waist circumference, and that looks into things like your sugar levels and your cholesterol levels. So your waist size, your sugar level, your cholesterol level, your blood pressure levels. You accumulate that, and it tells you if you're at risk for metabolic syndrome. The only treatment for metabolic syndrome, there's only one treatment for it, is diet and exercise. That's it. So if you diet right and you exercise right, you will get right. All right? That's it. If you don't, your risk of dying is equivalent to someone who smokes 2 packs of cigarettes a day. So that's a real number. So again, you're empowering yourself by doing that, and you're prolonging your lifestyle, your lifespan.
okay, I eat a lot.
Yes, ma'am.
A lot of all that you're not supposed to eat, but I don't gain weight.
Okay.
I just stay the same. I'm for real.
All right, I hear
And
it.
I be wanting to gain, here, there, but it come right in the stomach.
Well, as we age.
Well, as you get older, no, let me tell you that. But and now I'm glad we're in a room full of women.
You might not get punched.
No. So here's, I didn't talk about this, and thank you for bringing this up. Premenopause, menopause. Let's talk about this now. Estrogen levels start dropping at a certain age of a woman. Estrogen is very protective against heart disease because it slows down this process. So you're going to see a lot of women start getting heart disease and vascular disease and a lot of problems as they approach that premenopausal age. So that's why it's important to first know when your moms went into menopause. So mom went into menopause at 50. By age 45, you need to start taking mental note that I might go into menopause at 45, usually 5 years before. All right? Now, why is that important? Because your risk of your cholesterol number shooting off the roof is going to happen around that time. Because you're losing that protective estrogen effect that has given you all that good cholesterol all along. 2, when you eat, before you could eat anything, and then now you're eating the wrong things, and it's like you said, well, that starts happening. Your waist circumference actually starts, that is when it happens. So it also has to do with how we address this from your gynecological standpoint, what therapies are they giving you to treat that if you're symptomatic. So if you're symptomatic, there's some women who need therapy, hormone replacement therapy. And before, we always poo-pooed it and said no, no, no. But now there's data that says some of them are safe for some women who need it. It all depends on your levels and how much symptoms you have. During menopausal years, women will have subtle symptoms. You don't have the crushing chest pain or heart attack symptoms that you see we men. We're very soft. We heart attack, we're on the floor like you see on TV, crying and wailing. Women are just subtle. Some will say, well, I'm just tired. You know, I can't carry that bag that I used to carry, that, you know, from here to there, or I just sweat a lot, or, you know, I had a woman who came to me who had hiccups. Her hiccups were consistent hiccups, and then she had a subtle pain to her jaw. And now she was having a heart event. Subtle, very subtle. So, and more mainly it's fatigue, shortness of breath, just those things. Those are things that we have to take seriously when you see a doctor. Because they're easily dismissed as, oh, it's anxiety, oh, that palpitation you're feeling, oh, it's anxiety. No, hormonal changes do occur, and that too can affect your cardiovascular risk. All right? So that's a good discussion to have with not only your primary, but also your gynecological team as it approaches. Yes, ma'am?
So I have a question about sleeplessness or
Yes.
insomnia.
Yeah.
Does that have a connection to heart disease?
You know, they say you need sleep, and that's true. There's a certain amount of sleep that you need in the course of the day. Average 7 hours, 7 to 8 hours is what is reported out there. If you have that sleeplessness, you need to actually see a sleep disorder specialist first. If you don't sleep right, yes, your circadian rhythm is off, and then that can mess up what we call your catecholamines and some of the transmitters and little hormones in your body. And those two can affect either your reaction. So if you don't sleep right, you're gonna drink caffeinated drinks to keep you up, right? And those caffeinated drinks are not good for this. So you're gonna in turn get heart disease or irregular heart rhythms. If you don't sleep right, it's also gonna affect how you exercise or your diet. So those are things that too will affect this. So yes, it's all connected.
Think if you're tired, you worked hard, you're much more likely to run through a fast food restaurant than go home and cook and go to the grocery store because there's no other time. You're not gonna go exercise, and then it becomes a vicious cycle. You know, I watch some of the people, and some of them are my staff that are here, and their diet consists of donuts for the morning, a couple of snacks, some fast food, chicken tender, fried junk, added with a Coke or a sweet tea, and then dinner consists of some other fast food. There are no nutrients in those foods. And if you don't get the nutrients and you're not feeding, one simple intervene is you should have 2 cups of vegetables or fruit in a day. You're not gonna have the energy to do the things that you need to do. And then the next day you're tired again. And if you think you're gonna get it from a bunch of vitamins, you're not. Those vitamins are, especially these high-dose vitamin C's, vitamin E's, they have all sorts of other problems. Throw the vitamins away and eat for health, eat for nutrients. And I get to the sugary drinks. If you want to do one thing to change your life, you throw all those away. Do never, ever buy a Coke, a Gatorade, a Powerade, any of them. Children should not have them. It's equal to giving them a cigarette. Sodas are expensive. They're like $2. Water is cheap. So back to we can help. The sugar content is like 39 teaspoons of sugar. Nobody would go and buy 39 jugs, but for some reason we think that that's okay. And when you're drinking that, you're not drinking milk or filling your body with some nutrient that it needs. So again, you're depleting.
What are some fruit, some of the best fruits you can eat that doesn't contain or have a lot of sugar in it?
All fruits have sugar, but it's a different sugar. It ends in toast, but it is also mixed with fiber. It's mixed with nutrients, vitamin C's, vitamin E's, and all of those things, as I said, needs not to be stepped on, meaning no juices. Throw the juices away. I know, I'm so sorry. If you press squeeze orange juice, you're gonna end up drinking like 4 or 5 oranges. Nobody needs 4 or 5 oranges. And then you've taken out the pulp, you've taken out the nutrients of it, and the fiber content is what keeps you full. It's what regulates your digestive system, so you have better bowel movements, instead of just having the sugar. And what these sugars is doing is you intake it, and your body reacts to this high sugar content going through your body. So your pancreas starts producing all this insulin. When you're constantly doing this to your pancreas wears out. Or it either doesn't produce enough insulin, or it produces insulin that your body's no longer reacting to. And so then we start taking diabetes medicine. And if you're a diabetic, you are gonna spend thousands and thousands of dollars every year. And even if you have insurance, you're still paying 20% and you're going to a doctor. That sugar content, think of it if you sucked on a candy every day, never brushed your teeth are gonna fall out. You're bathing your blood vessels in sugar, and you're damaging these blood vessels. And this plaque goes because your body's trying to fix this. But that sugar, you're never getting it out. And if amputation doesn't scare you, and heart disease doesn't scare you, you have a chance of going blind. You have a chance of being on dialysis. Dialysis is not the way to live. Your kidneys are gonna fail. 82% of amputations start with a diabetic cut, or a wound on a diabetic, and that's how you're gonna get it. So stop thinking I just got the sugar. No, you've got a vascular disease, and that is what is happening. More likely of strokes.
So, is there, can you use stevia or a monk fruit to substitute?
Yes, if you're gonna do the sugary thing, stevia is probably the best. That's just a plant, and it has sweetening in it. And you need to very much limit it. Fruit is a great way to flavor your waters. I tell people, go and buy a lemon, orange. Somebody even told me they like garlic in their water. It doesn't matter what flavoring you like, just so you drink it. You should have 8 glasses of water in a day. If you're barely hydrated, you're less likely to eat and snack. Sometimes our hunger is really dehydration. Look at your urine. If it is this color or that dark orange, you don't have enough fluid in your body.
You got a question about the sugar added with you.
Not the sugar bag, it's the,
Throw it away.
the,
Throw it away. Throw it away. Flavor it with a real, something that God gave us, not a factory and a chemical. If you think this food industry likes you and cares about us, forget it. They want to sell stuff, and sugar is as addicting as crack. The more you eat it, the more you want it.
Some kids, it's a water with different flavors that says no sugar.
Yeah.
That's pretty good.
That's a much better alternative. But what I do is I cut up a lime or a lemon, I put it in the freezer, because it will last a long time. I mean, 1 lemon's gonna flavor your water for the whole day.
Yes, ma'am.
I have 2 questions. One, how do you see using raw honey as a sweetener as opposed to
Sugar.
still sugar?
It's still sugar.
My other question is regarding olive oil. I've heard once you open it, that it loses its benefits if it's open for a while.
You don't wanna leave it on your shelf for 2 years, kind of thing. And you'll notice in the olive oil, it's all in green glass to try to keep the light out of it. Keep it in the cupboard. One problem with olive oil, and I would suggest you buy it right now, is that they have just did Trump embargoes to Italy. Our olive oil is it's gonna be diminished. And the one thing with olive oil is don't buy it in these huge super jugs. Buy it in the smaller portions. Keep it in the cupboard. Keep it away from heat. If you have a cupboard like right next to your stove or you keep it out, don't do that because the heat of it is going to break it down. But small, little bit goes a long way. You're not deep frying with any of this.
The ginger root that you buy, is that good for your water?
Yeah, if you like ginger, that is a great
It's
way.
spicy.
I buy it in the produce,
Yeah,
put it in your freezer.
yeah.
That is a fabulous way to flavor anything. That and garlic, fresh garlic.
Okay, we just talked about the different diabetes and all that, and how it affects the heart. But what about things like polycystic kidney and liver disease? How do they affect it? I've heard there's no cure, there's nothing you can do about it, but it continues to affect your heart, your kidneys, your circulation.
You know, when you have these other awful diseases like lupus, autoimmune stuff, that is going to affect your heart. And unfortunately, we don't have a cure. But again, it comes back, the healthier you are, the more nutrients you have, the better any of those diseases are going to be.
Anti-inflammatory. So to her point here, inflammation is kind of underlying theory with all these liver disease and polycystic kidney disease as well. There's a genetic component to polycystic kidney disease that I'm not going to bore people with, but inflammatory disease can lead to liver disease, gallbladder disease, pancreatic diseases. So if your diet and nutrition that cause cardiovascular disease, if you look at all the data, they affect cancers and inflammatory states. So I lump all of those together. I'm a heart and vascular specialist, so I'm standing here talking about heart and vascular disease. However, the benefits for these extend beyond just my field. So a liver specialist will tell you that eating the right things will affect that field as well and will decrease your chance of liver disease, especially if you have diabetes. Diabetes affects the liver. Heart failure affects the liver, right? I mean, that's actually number one cause of liver failure comes from not only alcohol use, but also people who had congestive heart failure. So, and then that backs up into the liver and it causes it to be congested. So those are the things that are preventable if you do the right things and watch your salt intake and decrease your salt and, reduce the inflammatory properties of the things that you have.
I
Hey,
wanna
Jackie.
know about air fryers. Are they?
If you're not bathing it in oil, and if you're dipping whatever you're frying in a bunch of flour to go in there, I mean, maybe it's a little bit better and in moderation and it's a Sunday night thing, but if you're doing it day in and day out, it matters still what's in it.
The key word is moderation. I mean, we're not all perfect, and as much as you guys have heard us talk here today, I'm not standing here saying I'm perfect. I mean, I worked out last night and I drank some Gatorade, but that is not, I drink more water in a day than I drink anything else. So the reason why I drank Gatorade is because I need dinner and I needed, my electrolytes were off. So that's why I drank it at that point. The point is that I know right from wrong and I know when to go and what to eat and what not to eat. You have to have that base and you have to have that discipline. So I'm disciplined enough to know when not to eat what I shouldn't be eating and when I'm not supposed to drink what I'm not drinking. And so the key here is in moderation. You can start by just doing things in moderation before you go total cold turkey. And that's what we're trying to highlight to you today.
And if you can increase your vegetables to 2 cups a day, you're gonna eliminate something else that's not so good for you. You get rid of the sugary drinks and you replace it with water and you're well hydrated. You can increase your activity to the 150 minutes of exercise a day, or a week, not a day. And that means that you gotta sweat, you gotta breathe a little heavy, it's gotta hurt just a little bit. Don't think if you're just strolling, that's not gonna help. You wanna look a little ugly by the time you're done with this. You get rid of all of the nicotine, the tobacco, the vaping, all of those things. If you just did those 4 things, life would be a little bit cheaper. Life would be a little bit better, and you're gonna feel better. The more you exercise, the more you're gonna make these vessels bigger. So even if they have all this plaque in there, if you increase the diameter a little bit, for the long-term health, it's gonna make a difference. You eliminate those bad things for you to 1 night a week or 1 day a week. 1 day a week, you have a vegetarian diet. Get rid of the meat for 1 day. Replace it with beans, pastas in moderations. Just get rid of the meat.
Fish.
Replace the juice. You'll see, I never drink orange juice, but I have a tangerine every day. You're gonna do those simple things that make yourself feel better. And if you say your kids won't eat it, Starvation is a motivator. They will
On that note,
They will eat it.
on that note, this has been very, I mean, as much as we're standing here, we can go for a long time, but we understand everyone has a busy day ahead. And two, we thank you for the privilege of invitation and privilege of listening. It's not always easy for you to hear like a boring topic for an hour, but this seems to be very engaging. So thank you very much for being great participants. Where we welcome more questions, I just want to put it out there. And Jackie. Okay, they have. Okay, so we can go. Okay, good. Yes, ma'am.
3 meals a day.
Yeah.
Do you think that's a necessity, like, cause I always eat breakfast, lunch, and dinner. That's not necessary.
You need 18 to 20,000 calories a day. How you get it, it don't matter. And there is a new study, this intermittent fasting that everybody's talking about now. There are some benefits in the studies, but if you're a diabetic, do not do that mess. You're young and healthy, you can kind of adjust with that, but don't do that. And don't do keto. Walk away from keto, because that is one of the worst things for your long-term health.